Hello everyone. I'm just so sorry for the background noise. Today is the first chapter of pathology. So, first of all, I would like to start the chapter with certain terminologies. I just made a video of this, but I thought that video is going to be very long, so I'm going to make it short. So, first of all, what is a patient? Patient is the person which is affected by disease. Whoever person, it can be whoever, that person who is affected by disease are called patient is very common word. These all words are very common during pathology. So what is a lesion is the changes or characteristics shown by cells or tissue because of disease. If a patient means those person affected by disease. If a patient is showing certain changes, characteristics changes in their cells or tissue, those changes are called lesion. It can be because of disease. What is pathologic changes or morphology? Pathologic changes or morphology is because of the disease there are certain changes which are shown, which are called lesion. Those changes are called morphological changes. It can be seen during examination of diseased tissue. So to understand the disease or to diagnose the disease, we have to examine the diseased tissue of the patient. During that examination, we can see certain changes which are called pathologic changes or morphological changes. So there are two types of pathologic changes: gross changes and microscopic changes. Gross changes are all those changes which can be seen by our naked eyes, and what are microscopic changes which cannot be seen by our naked eyes, and we have to see it through microscope. So next thing is etiology. Etiology is also very common word. Etiology means, generally it means causes. What are the causes that are causing the disease in the patient? So this etiology is called causes. So for example, if a person is suffering from tuberculosis, there can be many causes like allergy, bacteria, pollution, yeast, anything. Those are called etiology. What is pathogenesis? Pathogenesis is the mechanism, or we can understand the cycle or mechanism by which lesions are produced. For example, to make in a factory, to make certain thing, like to make a chocolate, the chocolate, the cocoa have to go through certain process to become a chocolate. Like that, to successfully become a diseased tissue, the tissue has to go through certain steps by step, so that are called pathogenesis. So next step is, what is symptom? Symptoms are all those features which are seen in the patient due to the disease. Like, for again, I'm going to take the example of tuberculosis. If the patient is suffering from tuberculosis and he or she is showing certain features like cough, blood in cough, chest pain, night sweats, all of those features are called symptoms. These are also called physical signs. And next words which are commonly used are diagnosis, prognosis, treatment, and prevention. Diagnosis is what is wrong in the patient. For example, the word I said, tuberculosis, is a diagnosis. If a patient is suffering from tuberculosis, it is a diagnosis. Tuberculosis is wrong in the patient. What is prognosis? Prognosis is what is going to happen to the patient. Whatever is going to happen to the patient, it is called prognosis. Next thing, what is treatment? Treatment is what can be done about it. All those things, like if a person is suffering from tuberculosis, we have to give him antibacterial or whatever. Those treatment methods comes up under this word treatment. So what is prevention? Prevention is avoiding the complication or spreading disease. Whatever we do to avoid the complication or to avoid spreading disease are called prevention. It comes from word prevent. Prevent means to prevent from those things. Complication, what is complication? Are those risk factor because after disease or because of disease or because of whatever, if there are secondary things which are going to happen to us, those are called complications. I'm going to give a minor example. Diabetes is very common worldwide. Okay, so because of diabetes, the complication of diabetes are blindness. It is called diabetic retinopathy, but easily we can call it as blindness or kidney diseases or whatever. These are called complications. So complications are certainly to all those risk factors which can be arised by disease or through disease or after disease because of disease. So these are the common topics or common words which are used most commonly during the pathology. So this is the first chapter and first knowledge we must attain to start our pathology class. So thank you so much for this first class. We'll meet in second class, and I'm very sorry for my language if you are not understanding it, and also very sorry for the background noise, and also very sorry if the thing is very messy. Next time I'm going to improve it. Thank you.